Yeah, hi, I'm Steve Shore, Steve Insurance, and thank you very much for visiting our website or our YouTube page. So I'm going to discuss Medicare coverage of skilled nursing facilities, and then that gets into or begs the question of long-term care, home health care, going on Medi-Cal if you don't have long-term care or assets, so on and so forth. And then all the links that I show you here, they'll be at the bottom of the YouTube video. And if you have any questions, you can visit our website and ask them. You can email me. We're happy to help. Now, kind of what prompted me to do this video is I've recently had two friends and clients that are in skilled nursing care. And, it's not just that you think you need to be there, or even if your doctor says you need to be there. There's criterion that's confusing, complex, that says that if you don't really need the services, they're not going to pay for it. Maybe you only need custodial care, and we'll get into those definitions. So I like to go by official, insurance company brochures, government brochures, or show you the actual law. Because it's not what I say, it's not what I interpret, it's what the law says, the case law says, or the brochure. And, I just love helping people, making the insurance companies or the government do what they promise to do. And if you check the FAQs, especially on my skilled nursing page, you'll see where I've taken out the name and identifiable information and, answered those questions. And unfortunately, the two clients of mine, didn't have a whole lot of money. They don't really have long-term care, but then they don't have assets. So they'll probably be going Medi-Cal. I don't get paid to help you with Medi-Cal, but I'll certainly, look up all the information. I have all the reference material on my website. So anyways, this is the official Medicare brochure on skilled nursing. Now, if you're under 65, Obamacare covers it, but that's a separate issue. And I don't think that they have the limitations on number of days in Obamacare, but they're still going to not just pay for everything. They still got the medical necessity definition, which is a whole nother video. So I put in here bookmarks, but there's laws and rules about, putting in stuff on official government or insurance company brochures. So while I've got this on the video, it's not what's posted on my website or in the links below. But if you do want it and you send me a note that you understand that any marks that I did on here don't change anything in the brochure, I'll send it to you. So we've got our title page. It's a nice, pretty brochure. And then I went through here in the bookmarks to kind of, do what was the most important. And that's what we'll go over. So, Medicare is nice. They did put in, a table of contents. Okay, here they've defined what skilled nursing care is. And so where people are getting, their claims denied is you might not be able to be home. You might not be able to even get out of bed. But that doesn't mean, you need skilled nursing care. So it's care given, by skilled nurses to treat, manage, and evaluate your care. Non-professional staff isn't considered skilled care, and things that need to be needed on a daily basis, they're so complex, and you need skilled nursing and therapy professionals. Medicare doesn't cover custodial care. There are plans that, will cover that, and those are on separate web pages, separate videos. So the 7 activities of daily living, to trigger long-term care are, getting in and out of bed, eating, bathing, dressing, using the bathroom. I think there's 1 or 2 others. We'll see that, in a separate web page. And then the Medicare, brochure itself talks about other ways to get paid for custodial care, and we'll get into that. So what's the covered by original Medicare? So days 1 through 20, Medicare pays the whole thing. Days 21 through 100, you pay a daily coinsurance. In 2019, it was $170. I believe in 2021, it's $185 a day. And if you have a Medi Gap plan or a Medicare Advantage plan, the Medi Gap will probably pay that in full, and Medicare Advantage will give you a copay, so you have to look and see what that is. But like United Healthcare's copay, and I'm kind of to keep this generic video, but theirs is $184 a day copay, so they're not really giving anything away. So it's just something you got to look and then fill in the gaps. And so, anyways, well, if you have more questions, just email me or put it at the bottom of the website. So, why do you need skilled nursing? If it's necessary to improve your condition, maintain your current condition, or get it from getting worse. So all you need is somebody to help you get in and out of bed or cook for you. I guess you might argue that that's maintaining your position, your thing, but they're not going to fly for it, and we'll get into more details later. How do you find a skilled nursing? I'm not really going to go into that. I do have a separate page on that. Here's like more detail on the skilled nursing and what it pays. But the problem is, well, need, we already did that. Skilled nursing, medical necessity. So, Medicare doesn't just pay whatever you think you need or even whatever your doctor thinks you need. And I know I've spoken to people that say we should have Medicare for all because then Medicare will just pay everything your doctor says. No, it doesn't work that way. So it's what your doctor ordered, can only need it on a daily basis, something that you can only get in skilled nursing. Again, medical necessity. It says only if all of these are true. So if one of these, like 7 things, isn't true, then they're not going to pay for skilled nursing. And then, reasonable and customary, is a big deal. How long? Okay, here they go into examples of people that got paid or not paid. Here's what's covered in a skilled nursing care: your room, your meals, the skilled nursing care itself, physical therapy, medications. Here's page 20, how to get help with the costs. And there's also Medi-Cal, in-home social services. Of course, you can get long-term care coverage, a Medi Gap policy. This is the first time that I've been able to, mark this thing up. So, I thought that was pretty neat. The downside is that the control is way over to the left. That's why you see my head turning. But I'm trying to keep eye contact as much as I can. My camera is right next to where my face is showing, so that helps. Okay, so then they've got assessments. They have to see like how well you're doing, what your goals and what everything is. And on my long-term care page, I have more information on like the Lofton scale of assessments. And then there's a care plan, and it really depends. Does your care plan jive with what skilled nursing does, or can you go home maybe with home health care? Medicare does pay for home health care, and that's like a whole separate video. Now, if you think your coverage is ending too soon, like the 2 clients I recently had and then 1 website visitor, there's ways to go in and appeal it. But when you do an appeal, I think you got to look at it like a court case. And I'm going to pause this for a second. Anyways, I just put up my webpage on Medicare Appeals, and I'll show you that in a second. But when you're doing an appeal, it's almost like a court case, and you can't just say, oh, please let me have these services, I'm appealing. No, you've got to do your homework and put together a case and show that you meet all these qualifications. So not only do I have the summary here of what's in the 50-page brochure, but I've got more details on my webpage that'll show you what you need to put together. And you're going to need assistance with that because the medical terminology is beyond my pay grade. So here's other things talking about planning ahead, and that's why I'm sending out this video so you can look at long-term care insurance. Or there's another video, the state of California put out a brochure on taking care of tomorrow. So even if you say you have no money, you can't do any planning, no nothing, at least do the stuff it's not going to cost you out of pocket so that if it ever happens, you're prepared. Now here's a skilled nursing facility checklist for checking out what places you're going, but I don't think it's all that important because I think when you get released from the hospital, the social worker or staff at the hospital will find you a place, and it's not like you're really in a position to say, no, I want this skilled nursing or that skilled nursing, unless you run around now and check out skilled nursing and say where you have a preference. Medicare has other publications, and I'll show you those in a second. And then, here's their definitions. So let me go over now the different, tools and web pages that we've got. And at the bottom of the YouTube video, I'll have links to all these pages. So here's how does Medicare cover skilled nursing. And when you click here, I'm going to change that so that you'll see that there's a video there too. And then like Oscar has clinical guidelines that go into a lot more detail of what you need to get admitted, and if you're missing one thing, you're out and you got to look for custodial care, a different level of care. Medicare's done nice videos on Medicare and nursing home care, and if you think this video is long and boring, well then maybe you ought to listen to theirs for a minute and a half, which will gloss over it. They also have a video for planning for discharge. As we said before, the Medicare manual says if you have Medicare Advantage or Medi Gap, that can help you pay for the long-term care. So here's our webpage on what Medicare Advantage does, and we put in a separate video for that. 7 activities of daily living, bathing, ambulation, toileting, dressing, eating, getting in and out of bed. And, here's the brochure on taking care of tomorrow, NOLO's guide on long-term care, National Association of Insurance Commissioners on long-term care. Then we do have a plan that only covers home health care, so it's a lot less expensive than long-term care. And there's no medical questions asked, just as long as you're not currently in home health care or that you don't need it eminently, then you can qualify. Technically, it's not insurance. Then we have the Lawton instrumental ADLs. So a lot of this stuff is technical stuff that I've got here, but I don't know that I can really help you argue the technical medical stuff because it's beyond my pay grade. I took physiology in high school, and that's about it. My interest more is in the legal mumbo jumbo, and then you need to get your doctor to help you write the right kind of letter. Here's Medi-Cal and long-term care. And this was done in 2001, but pretty much it's the same thing. And then here's a more recent guide on long-term care. The downside is if you take Medi-Cal long-term nursing care, they may take all your assets when you and your spouse pass away. But there may be ways, to put your assets in a trust and all that. And we do have a listing here for trust attorneys that might be able to help you with that. Here's a page on, home health care. It's on the same as the long-term care page, but it tells you what Medicare will pay on home health care. Here's our web page on finding and choosing a nursing home care, and Medicare did put out a whole separate publication on that. Nursing home checklist, you saw that. And then here's where we go into what medical necessity is in general. But back here, look at these clinical guidelines from Oscar. And I show Oscar because they put it in like plain, simple English. The Medicare guide on skilled nursing kind of glossed over it, but they gave you an idea. This is a little more detail. So here we go again, medical necessity. Medi-Cal has in-home supportive services. So if you just need help with house cleaning, meals, laundry, grocery shopping, grooming yourself, going to the bathroom, they can do it, getting to medical appointments, or if you're not mentally okay anymore, making sure that you don't hurt yourself. Now, if you do have money or income that puts you out of getting into Medi-Cal, there is a program called Share of Cost, and so they make you pay maybe the first $500 a month of expenses. If you get a Medi Gap plan, that'll pay the copay generally in full, and here's our page, kind of generic on that, and here's where I did a separate video. If you file an appeal, it's farmed out in California to Levanta, and here's their information, on how to file an appeal and so forth. But as far as filing appeals, you want to look at, the FAQs that I've done where someone showed me the denial that they got, and my suggestions for them to, do it. I did contact a couple of attorneys to see if they could help, but I didn't hear back. So I guess there's no money in it for attorneys. And it's not like you're going to pay, $20,000 to an attorney to take care of it. So I think really it's your doctor that's going to have to, fight for you. So, God forbid, if you're in or need long-term care, you may not have a whole long time to live. So Medicare does pay for hospice. And, under 65 Obamacare will pay for that too, but that would be a whole separate video, or just ask me about it, in the FAQs. So, here's their brochure on hospice. Medicare has done some videos on that too. And then here's our webpage on how to file Medicare Appeals. And so to me, I think it's really important that you put together a good appeal and don't just say, please look at this, because, they've got the same information. You got to give them new information to show them why you qualify and to show, why you think that they made a mistake. So thanks very much for watching. If you have any questions, just email me, steve@steveshore.com. We can set up a Zoom meeting, or, you're welcome to ask, questions here, and then, we'll do our best to research and answer. That's what I live for. I'm like the Maytag repairman. waiting for something to break. And if you look at my website, most of the questions that I answer are not my clients. They're people that found the website. And, you know, like here, Medicare has a whole booklet on like when you can get a knee replacement. So I'm not called Mr. Google for nothing. So if you ask me, I'll look, you know, till I get the right information for you. Thanks a lot.